Why are patients with Parkinson's disease afraid to ask their neurologist for Mucuna? It is totally normal to feel unsure about talking to your doctor about alternative therapies like Mucuna. We understand your concerns. You are worried your doctor will be skeptical, disapproving, or even blaming you. Some patients are interested when they hear about others who have found natural remedies work. They are looking to see if they can take less or even stop taking conventional medication. But they do not know how their doctor will react, so they investigate these options on their own, using little information they find online. This is risky. It is important to have your doctor on your side when you are trying out new treatments, including Mucuna. Without guidance, patients may unknowingly misuse or mix it with other medicine in ways that reduce effectiveness or increase risks. See for advice from a doctor. Meanwhile, in patient forums and even among some receptive doctors, there has been a growing idea that early Parkinson's can be treated with less conventional approaches, possibly delaying the need for standard drugs. It is important to remember that while drugs are necessary, starting them too early or at high doses can cause problems in the long term. There are other ways to explore too. For example, exercise is a fantastic alternative treatment for slowing down the progression of the disease. Parkinson's drugs are highly effective at managing symptoms, but unfortunately, some patients experience complications such as dyskinesias, uncontrollable movements, after several years. These are not caused by the disease itself, but by years of medication. Doctors have tried to delay the use of levodopa, such as Sinemet or Madopar, by starting with less potent alternatives such as dopaminergic agonists, such as pramipexole or ropinirole. However, these substitutes also cause side effects over time, including sleep disturbances, digestive problems, and impulse control disorders. On a more positive note, some patients have been able to delay the need for these drugs by making a few simple lifestyle changes, getting regular exercise, and even trying Mucuna. The great thing about Mucuna is that it can delay the need for conventional levodopa or dopaminergic agonists for years, potentially sparing patients some of the side effects. In my 30 years of practice, I have seen patients try natural options with hope and determination, even when they are unsure. Levodopa is a great drug when used correctly. It is also worth noting that because something is natural does not necessarily mean it is safe. It is a shame when patients try Mucuna without guidance because they are afraid of being judged. Mucuna can be risky when mixed with other Parkinson's drugs. This is particularly the case when doctors may not be aware or interested in Mucuna, perhaps because there have not been many clinical studies done on it yet. Despite all the research that shows its benefits, there is still not much interest. Another thing to watch out for is that products can vary in concentration, which can make dosing tricky. This can be a bit confusing for patients and doctors. Some manufacturers are making things worse by selling misleading products. This can lead patients to try things that are not safe. There are many Mucuna products that vary in dosage and quality. Find a knowledgeable pharmacist and a practitioner who understands Mucuna and how it works with other PD treatments. The doctor should guide you on dosage and timing. Don't try to self-administer Mucuna. If you follow this advice, you might be able to delay taking conventional medications or use Mucuna alongside conventional therapies under your doctor's supervision. This three-part strategy provides a safer, more rounded option for managing Parkinson's disease.